The recording has been started.
All right. Hello, everyone. My name is Usman, and I'm going to be presenting about autism. The goal of this uh, chat is going to be to help you understand what autism is and how can we identify different signs and symptoms of autism, and what can we do in terms of treatment. So let's start. So the first thing is Donald Triplett was the first guy who was diagnosed with autism, and it was by Dr. Leo Kanner at Johns Hopkins University. And he recently passed away in 2023. So it has only been 80 years since we have starting to know about autism, and we are learning a lot of new things about autism. Let's watch a video, and it can give us a general idea of what autism is, and then we'll go from there. Okay.
Zainab is saying there's no audio and I can't hear it too.
Okay. Um, so sorry about the audio. I'm not sure how I can fix it right now, but there's a video, amazing things happen. We're going to put in the recording later on. So this explains how autism works, and then what you should expect in kids with autism. All right, let's continue.
Uh, if you go to the slides one more time in the
Hmm.
slide mode and try to run it one more time, maybe you would find something like maybe we can fix that problem.
Okay.
Maybe not.
Still no
No,
audio.
no, no audio for us.
Okay, that's okay. Um, all right. So let's go to the next slides. So basically, autism diagnosis has been increasing over the last few decades. So if you look at this chart, in 1970, there were 1 in 10,000 people who were diagnosed with autism. But CDC data shows like 1 in 36 people are diagnosed with autism in 2023. And the reason being, now people are more aware of the signs and symptoms. And also, there has been some changes in the DSM criteria for autism, which has led to the increase in the prevalence of autism. So, what does a psychiatrist, how do we diagnose the autism? There are multiple ways to diagnose autism. There are different scales which are there, which can help us identify different symptoms of autism. But at the end of the day, everybody follows the DSM-5 criteria to diagnose autism. The list of the scales you can see, they are used by different clinicians to diagnose autism. Different signs of autism. People would see autism symptoms in different people by looking at the communication. Maybe you see a kid who prefers to play alone, or sensitive to sounds, or they are avoiding eye contact, or they have trouble interpreting other people's feelings. So those are generally the signs which people see. We're gonna take a deeper look. into the signs and symptoms of autism. So the symptoms can be divided into two categories. One is social communication and social interaction, and the other one is repetitive and restricted patterns of behavior, interest, and activities. Both groups are further divided into subgroups. Okay. So the social communication and social interaction piece is divided into social emotional reciprocity, non-communication, non-verbal communication, and relationships. While the restrictive behaviors, they are divided into routine, interests, sensory issues, and then stereotypes or repetitive behaviors. And we're gonna talk more about them in a second. So, first of all, let's say you go somewhere and then you meet a lot of people, right? And then you make small talk with other people and you are able to sustain some conversation, even if the topic is not of your interest. You share what your enjoyments are, achievements are, and interests are with other people. And if someone is talking about emotions, so you try to share empathy with them, or if you are feeling sad, you are able to express your emotions. So that's how normally we do interactions whenever we go to a new place, right? And if two people are talking to each other, then you stop for your turn before talking, right? So in autism, there are difficulties in initiating the conversation. So it's hard for kids with autism to start a conversation, or they might be socially inappropriate responses could be seen with autism. And then they have a hard time sharing their emotions, or like if somebody else is sharing their emotions, they can have a hard time showing empathy, right? And then if there are things which are in their interest, they would talk about it. If they are not interested, or it's somebody is like very excited about something, they wouldn't respond in a way the other person is expecting them to respond. Okay. So the second thing was the non-verbal communication. Whenever you talk to somebody, right? So what happens? Both people are facing each other, they are making eye contact, and there is a coordination between the facial expressions and their body language. Their voice changes with emotions, and then we call this like a rhythm in the tone of what the speech, right? And let's say if somebody is being sarcastic, right? So the voice can change like, oh yeah, or really, or something on those lines, right? And then you can tell like, they are being sarcastic. And as kids, we like children point towards things which they show interest in, and the adult can see like, the kid is showing me something. So with autism, we see poor eye contact, and then there is like a very monotonous tone generally. And this is like every kid is different. So I'm just giving you general ideas of how things can be seen in autism. So the monotonous tone in the voice and having a hard time understanding sarcasm can be seen. The third of the things in the social communication group is the deficit in building and understanding relationships. So humans are social animals, right? So they need friends to go through their lives. When young kids engage in pretend play, like cops and robbers, and they also imitate what they see in adults. So growing up, they're interested in making and keeping friends. And they're flexible in hanging out with people with different interests. And they also understand jokes. So making friendships is a very important piece in our lives generally. So with autism, you might see that they have a difficult time developing and maintaining the relationships, and then adjusting to the social context, and also like as kids, like having a hard time having imaginative play or even making friends. So the next group, so we already talked about the three things in the social interaction group. So now we are going to talk about the repetitive behaviors. So when anyone gets frustrated or angry or overwhelmed, they are able to express their feelings through their words, right? So just imagine like you're not able to express, and which probably makes you even more frustrated. Sometimes I see like people gets aggressive, physically aggressive when the other person is not understanding their point, and they are having a heated conversation, and they end up fighting. So in kids with autism or even adults, you see some behaviors in terms of motor movements and also speech, which we also call stimming. When they get overwhelmed, you can see them flapping their hands, or they're swaying or rocking back and forth. And in speech, you see like repetition of words, or they might be saying some phrases over and over again. They might see a video on YouTube or something, and then just they repeat that continuously, right? Uh, Whenever generally like you make a plan, and then life happens and you're supposed to go out, let's say, and it rained, you're stuck at home, right? So I ask kids, what would you do if you had a plan and you were not able to go through the plan? So they were like, We'll find something else, we'll find an activity or do something different." So in my clinic, I see a lot of patients. So a lot of times the parents would tell me like they were supposed to come to the hospital on a certain route, and then because of like construction or something, things changed and they took a detour, and that detour led the kid to have like a outburst, and they just like lost it, and they were hitting or kicking, screaming, shouting just because of that small detour. And why didn't we go on the same route? So that brings us to the second symptom in the behavior piece, where there is a lot of insistence on sameness. Like you have to adhere with the routines. It cannot be like, oh, let's do something different today. So they have a lot of adherence to the routine. So that can be very problematic at times. The third thing is interest. So when you talk to kids or adults, they might tell you like, we are interested in sports, we play video games, we like hanging out with friends. And somebody would be like, oh, I love soccer, but I also play um, something else like tennis, and I also play video games, and I also do this. So with autism, a lot of times we see that the kids have very specified, circumscribed uh, interest. And let's say they like trains, so it's all about trains. Or I remember a kid, he loved the whales, the fish. It was everything about that. So they would know their biology, anatomy, physiology, everything about whales, like history, which whale is the biggest whale in the world, the smallest one, where can you find them? But as soon as you go to another topic, they lose interest. So it's all about like, okay, let's talk about this thing and only this thing. All right. And then the fourth thing is the sensory aspect. So normally, if there are loud noises or some changes in texture, kids adapt, and they're like, okay, it's loud, but I'll go with it. With kids with autism, they can have heightened sensory stimuli, and then sometimes it can be the opposite too. They might have low sensory threshold, or it can be high, it can be low. So by that I mean they can be very sensitive to touch, but they can not be sensitive to touch. Like even if you are squeezing them really hard, they wouldn't feel anything. And then there are a lot of other there are mainly we know about the five senses, but there are like eight senses, vestibular, interoceptive, and proprioceptive. They're not much talked about, but a lot of time kids, you find them spinning just to keep them grounded, so they can have some specific taste stimuli too, like their diet can be very restricted. They only eat certain foods, and that's all they eat. So that's the fourth thing we talk about. So again, before going to the next one, so the the three social interactions we talked about, and then the four repetitive behaviors we talked about. So, in order for us to diagnose autism, we have to have three out of three social interactions. So, basically, the reciprocity, nonverbal communication, as well as the relationship building, they all need to be present. And then you can have any two out of four of the rest of the four we just talked about in order to diagnose autism. So we talked about the signs and symptoms, but then there are a lot of strengths which you see in autism. And every child is different, right? The world would not be the same if everybody was neurotypical, let's say. And then like we need diversity in thinking and the way we approach things in order to make this world the way it is right now. A lot of times we see kids with autism who can have like attention to detail. And then when they do something, they are like really doing it accurately. And then you can see they can absorb and retain facts, and they will memorize the whole thing from cover to cover. All right, and then they have expertise in some skills, and they do amazing in those skills. They are very creative. Like, I have been amazed by seeing how creative kids with autism can be, and they are very accepting. Another thing pops in my head is a lot of times the kids in regular classes, they go like, we love this kid in our class who has autism, and the reason being they are very accepting. They don't judge you, they don't ask you questions, they don't bully anyone. So that's why there are a lot of strengths we see in autism, and that's the beauty of it. All right. So there are three levels of autism. So first we talked about what are the signs and symptoms. We talked about the strengths. Now we talk about the levels of autism. So there, the DSM has divided the autism into three levels. Level one is which require minimal support. So basically, they will have social communication problems, as well as they will have the behavioral issues. So, but they just need like some support so that they can go through their day and get their things done. Level three is they require substantial support. Like, they cannot function without a lot of support. All right. So level one is the least support requiring, and the level three is the most support requiring, and level two is in between. Right? And the problem we see with this linear representation is that it lumps everything together. So they look at the spectrum in a way that this is a straight line, and you can be less autistic and you can be more autistic. Uh, it's easy to say those things, but in real life, it's it's very hard to understand what do you mean, like by less autistic or more autistic. That doesn't help neither the families nor the kid. So now we have an emerging concept, right? It's called autism wheel. So rather than looking at things in this way, where it's like a linear line, we look at things in like a whole holistic approach. So what this wheel does is it breaks down different symptoms into different groups. So you can see on the wheel there are different triangles, which makes the whole wheel. And you can see that on the right hand side, you might see like there is issues with abnormal posture. But then the speech is less of a problem. So by using this approach, we can help communicate with different professionals as well as and we are also working on this concept too, so that we can make a wheel which is very individualized approach, and everybody would have their own wheel. And then when they go to the next person and they look at this, they can be like, huh, so you don't have any issues with non-verbal communication, but you do have issues with uh, friendship making, relationships, or you have no sensitivities issues, but you are very fixated on routines, right? So, and then that will also help not just like communicating with different professionals, but also we can focus our services towards the specific thing they are lacking. Okay. So I just wanted to share this with you guys, that this is something which is in work. The last thing I would talk about is, what do we do next? Right. So the management of autism, it's a diagnosis which brings a whole team together in order to help the kid. So it's a multidisciplinary approach. So the first thing, normally we after diagnosing a kid with autism, we ask the families to reach out to different specialities so everybody can come together to help the kid with whatever problems they are having. So the first thing is early intervention, which is ABA. There are some controversies around the ABA approach, but it has been helpful for a lot of families. They have modified the approach over the years, and now like they are not focusing on one specific strategy to help the families. They incorporate different approaches from different strategies to work with the kid. Um, it's called ABA, Applied Behavior Analysis, and it helps with modifying the behaviors seen in the kids. The other thing, you might remember we talked about like the non-verbal communication and relationship building. So with the non-verbal communication, you can get help from speech therapy, where they can help you with like different kinds of speech expressions, what to say. And then the non-verbal piece would be occupational therapy, which can be helpful. Uh, the kids also have problems with relationship building or working with other kids. So there are social skills group. By social skills group, I mean is bunch of kids come together who are having similar problems, and there is one therapist who work with different kids, and they help them how to approach the kids, like what are the social norms. Like let's say there was one group which was mainly focusing on interviewing skills. So when do you like making an eye contact with the person who is interviewing you, and then when is it appropriate to start talking or listen to the other person, or body language. So they help with the social skills which are very important in day-to-day life. um, there are a lot of times psychiatric problems with autism. Like you can have multiple comorbidities like depression, anxiety, ADHD, and for those things you need psychiatric help. So psychiatrist plays a very significant role in addressing those comorbidities. And then there are a lot of behavioral issues. So parent management training would be something where they help the parents to address those specific behaviors. Sometimes we see neurological issues like EEG can be done for ruling out any seizures or any other neurological things if they are an issue in any of the kids. And then,
We have a question.
okay, so
Uh,
go ahead. We can.
Zainab is asking if in the circle in the middle, is that how you spell sensory? What,
Circle in the middle, which
like
one?
what? I think she's curious about the circle in the middle of this picture. What is that for? Oh,
So
he.
basically, so the one which where the kid is saying something and the person is reading.
Okay, got
right?
it, got it. Yeah,
So
basically, I think her question was from a different slide, but we moved on. But good.
I can go back. Uh, you can tell me which
Zainab,
slide.
do you want to chime in? Like, which slide was that? Back? Maybe over. Oh, the 8th sensory systems. Yes, she's talking about this one. And in the slide in the middle is that you spell. Oh, okay. She's wondering if the spelling of sensory is correct over here.
Thank you for picking on that. I think it's spelled wrong, so it should be the eight sensory system. Thank
Got
you
it,
for
got it.
correcting that.
Thank you, Zainab.
All right. So going back to the management of autism. So basically, um, sometimes kids with autism have feeding issues, like they have a very specific diet, and because of that, we might, and then they might have difficulty swallowing a pill. So we can help with that. Management wise, treatment wise, there is no treatment. It's basically the way we see autism is it's a different way to approach things. It's a different way to look at the world. So we don't want it to be like changed. Okay. But we also want to make sure that if the there are some problems being created for the kid due to lack of verbal communication, we should be there to help them out. And in order to do that, there can be some dietary issues, there can be some medical problems, there can be some speech issues. So the whole team works together, and then we help. And also school plays a huge role. We have like special programs in schools where we put the kids in IEP, individualized educational plan, and then or a 504 plan at school, which can also give more services to the kid to help them flourish and learn a lot with the other kids. All right. So I think that is the end of the presentation for me.
I have a question.
Sure.
So, are there any programs or services which basically focus on the kids uh, who have the autism? Do they like have something a special program which focuses on how to help them so that when they grow up, they can earn the living?
Yeah. So, for let me give you a broad answer. Basically, the autism starts at a very early age and it goes on until you are alive, right? So we have early intervention programs, and there are a lot of screening tools. We briefly mentioned the screening tools before. So from under 24 months, you see kids who have these specific like signs of autism, so we can intervene very early in life. And if you see a kid not showing interest or not pointing at things, you can pick on those and then start the services very early. When the kids grow up, gradually, like there are a lot of programs when they are teenagers. So during the before the teenagers, when they are early school life, the school provides a lot of services. Then they turn into teenagers, and then during teenage life, there are a lot of resources which help them do some jobs. So a lot of kids, like my patients, they go to Walmart or different stores, and they work there for specific number of hours. And a lot of companies now are understanding how important this is, and they make some jobs just for them, like libraries and different public services. They have those jobs. When they grow up, I have a lot of adults too who have autism, and there are social skills group, like I mentioned before. So they help them with interviewing skills. They also help them with like how to find a job, and then they also accommodate them during the job. So I give them a letter of recommendations. Like if you make sure that you very clearly present the task on hand, and then you set the goals, reasonable goals with them, and talk about them. And then there are a lot of workplaces who have resources, how to apply to those jobs, how can the people with autism can be helpful in the workforce. And now the most recent thing, as I mentioned, like initially, the it has only been 80 years since we found out, or we have started learning about autism, right? So in Massachusetts, one of the places here, they are making a geriatric psychiatry for autism. So what that means is now the people who were kids before adults, and now they are old, they need services too. And they need like special home, the old homes, they are very focused on people who probably don't have autism. So now we have to focus and make some places so that the kids who were kids and now are old need to be like in an environment where people can understand them and they don't get frustrated even at an older age. So I'm like, that was a long-winded answer to your question. So basically, yes, there are resources which help them get a job, and then they also have services on how to handle money. So sometimes people with autism, they have a hard time like with calculation or management of money. So there are aides who can help them, like so that other people don't take advantage of them.
Got it.
So yeah.
Uh, just a time check. We have last 3 minutes. Another question I had was, is ADHD one of the spectrum of autism? Like,
Uh, Yeah. So ADHD, which is attention and hyperactivity deficit disorder. So basically, ADHD is another neurodevelopmental disorder, which means like it also occurs in early age. And the main issues with ADHD are inattention, hyperactivity, and impulsivity. And it's very different from autism. There are some similarities, but again, it's a different entity. But having said that, there is a lot of comorbidity. By that, I mean, like you see a lot of ADHD in kids with autism. So whenever you diagnose somebody with ADHD, there is a whole treatment algorithm, and you should definitely address the ADHD symptoms.
also,
So, but
Zainab is asking if is OCD similar to ADHD and autism?
So that's a very good question. So with OCD, which is obsessive compulsive disorder, there are a lot of things like which are similar to autism. So in OCD, let's say you have to do things in a certain specific way, and it has to be in that certain order, right? And as we talked about autism, and there was like a specific way. I can go to that slide too. So this one. So there is a lot of insistence on sameness. Like you have to adhere the routine. So one of my tasks are to distinguish OCD with autism. And it's very different from ADHD, it's very different from autism, but there are sometimes what happens is you might also see OCD in autism, right? The way briefly I'm going to touch on that is with autism, it starts very early. OCD starts later in life, right? And with OCD, the obsessions and the compulsions, they are very ego dystonic, which means like the person who is doing it doesn't like it, right? With autism, it's the way they are functioning. Like it's a lot of like we want to do the sameness, and whenever you mess up with the routine, that's where the anxiety or the distress comes in.
Got
So
it.
I think
And
that's
I
the main.
think we're with that we are at time. Thank you.
Okay. Thank you, Surya.